Yes, sir. Sir, we are going live. We are live in 3, 2, 1. We are live now, sir.
Good evening to all of you. Welcome and greetings from Sexual Medicine Committee, FOXY. It's our initiative by the Sexual Medicine Committee to choose a topic and give a talk about those topics, which is the problem and how to deal with them, how to identify them. This is a case-based study, and this time we have a very interesting case, a very common case, that is the erectile dysfunction, by one of our great faculty for today, Dr. Narayan Reddy sir. So before we start this program, first I would like to start with the FOXY theme video. Rohit, can you please start with the FOXY theme video?
Dear friends, Foxians and women of my country, I am Dr. Shanta Kumari, President of the Federation of Obstetrics and Gynecological Societies of India. As a little girl, I told myself that I have to become something to make a difference. I always believed that if I desired something wholeheartedly, there is a positive force which makes it happen. And here I am, friends, standing in front of you as the 60th President of FOXY, the 38,000 strong committed body of OB-GYNs taking care of women's health in our country. As a young girl, I realized that women play a key role in this world, just like Mother Nature or Stree Shakti as we revere it. It is a guiding force behind all forms of God's creation. And it's only a woman who can actually create a new life.
Hi, I'm Kareena Kapoor Khan and I'm so happy to be here with you, if only on video. Pregnancy is a beautiful experience and I have loved having my babies. I congratulate Dr. Shanta Kumari as taking over the 60th president of this eminent organization.
Stree Shakti is the embodiment of 5 elements: the sky, the air, the water, the earth, and the fire. Any imbalance in any of these 5 elements creates chaos and calamities. Similarly, when a woman's health is neglected, it disrupts the universal equilibrium. The intimate link between environment and human well-being is very well known. With increasing awareness of the need for clean water, pollution-free air, and pesticide-free food.
Hi, I'm PV Sindhu. Well, it's such a beautiful feeling for me to be an empowered girl, to be a girl in a nurtured and a safe environment.
Protecting health by preserving nature and its ecosystem is easier than curing any disease. So we have taken up the concept of minimizing the female morbidity and mortality and fetal effects by mitigating the adverse impact of environment. My theme this year goes beyond FOXY's commitment towards women's healthcare. FOXY for all, always.
FOXY for All is another inspiring campaign. What you do in this organization impacts the lives of all of us women in India.
And Dhira to stop violence against women. FOXY for all, always will strive to make the girl a Sahasi with Swachhata, Samruddhi and Swasthya. To be Surakshit with Shakti to reach her full potential as a woman.
Dr. Shanta Kumari with the theme FOXY for all always and Dhira Stop Violence Against Women will empower many girls. I firmly believe that only a safe girl, Surakshit Kanya, can grow into a healthy woman, Swasth Mahila.
Violence against women. I think it's a silent pandemic and I'm so happy to be a part of this campaign.
If any woman has a problem, where does she go to? Not to the police or court or the lawyers. She goes to her friendly OB-GYN, who is her first point of contact for help. So I have started Dhira, an initiative close to my heart, to sensitize our OB-GYNs, the police, the public, and to partner with men to say no to violence against women.
I completely support her vision and mission as President Foxy and also especially support her campaign, Dira, Stop Violence Against Women.
A healthy environment is the core of a woman's health. A healthy woman makes a family happy and a strong nation. I, as the president of Foxy, declare my commitment towards women's health and safety.
So after this inspiration video, now I would like to invite my co-moderator, Dr. Atmik Jain, to welcome our chairperson, Dr. Neeraj Jadhav, sir. Dr. Atmik, over to you.
Thank you, Apurva, sir. It's an honor for me to introduce Dr. Neeraj Jadhav, sir. Thank you very much, sir, for making me part of this session. We all know that by the knowledge of Dr. Jadhav, sir, and his generous efforts, a change has been made. Because of him, all the gynecologists over India and outside India also have joined hands together to come together on a platform to learn and upgrade their knowledge of sexual medicine. I welcome you, sir. Dr. Neeraj Jadhav, sir, is a chairperson, Sexual Medicine Committee, Foxy. He's a vice president, Rajkot Menopause Society. Over to you, sir.
Thank you, Dr. Atmik. So, good evening and welcome to today's webinar. This is our series of Conclusion to Consensus series, and this is our 5th session of this series. Earlier, we have completed masterclass series where we have a total 6 sessions where we covered so many female sexual dysfunction as well as male sexual dysfunction. But that was a more of theoretical part. So after finishing masterclass, we thought, okay, sometimes what happens, we know so many things about the disease or dysfunction, but when patient come to us, we become confused how to manage this patient, because we have so many options to choose from. Which will be the best option for this patient? It is sometimes very challenging. So we, with this aim, we started this Confusion to Consensus series, where we take one dysfunction and we discuss cases related to dysfunction. So up till now, we have covered female orgasmic dysfunction, we have covered female desire disorder, we have covered genitopelvic pain and penetration disorder, and we have also covered premature ejaculation. So now this is the 5th session where we are going to talk and learn about the erectile dysfunction. And I'm very happy to have a eminent teacher in the field of sexual medicine, that is Dr. Narayan Reddy sir with us. He is going to teach us how we will manage these cases, and we have so many things to learn from him. So I'm very eager to learn from him and to know more about this erectile dysfunction, how we can manage better in a better way. So let's have a good academic session and learn so many things from our today's case discussion series. So welcome once again, everyone, and I hope you will enjoy this session. So over to you, Purva and Atmik.
Thank you so much, Neeraj sir. So before, as we always started, and we are getting blessings for our senior. So today we have a very special guest with us, chief guest for today, a man with a golden heart. And sir, you are the inspiration of not only me, but millions, thousands of Foxians like me who want to work for the Foxy. Sir, you doesn't need any introduction, Jadip sir. Sir is the president-elect Foxy. Sir is the past Secretary General Foxy. Sir is the past Deputy Secretary of the AOFOG, chair of the Safe Abortion FIGO, and what not. Sir, is the what I always admire about the sir, any Foxian, not only me, any Foxian called sir any point of time in the night, 1 o'clock, he's always there for each and every Foxian. So thank you so much, sir, for always there, for always blessing us. So over to you, sir, for your kind words.
Thank you very much, Apurva, for that very kind, warm, and very generous introduction. Let me first begin by thanking the President of FOXI, Dr. Shanta Kumari, Secretary General, Dr. Madhuri, and Dr. Bipin Pandit, the Vice President, who are all looking after FOXI's work so efficiently. Let me congratulate Neeraj. Neeraj, I know that this is not the easiest committee to work with, starting from raising funds to finding topics and speakers and faculty. Everything seems to be an uphill task, but I must congratulate you on the wonderful work that you have done. You've really taken it upon yourself, spread the message of sexual medicine far and wide, and I think it is a very important message. There are so many misconceptions, myths, and taboos about sexual medicine and sexuality in general, not only amongst the community, but even amongst physicians. So I think the work that you're doing is extremely important. And the topic that is chosen for today, erectile dysfunction, is also a very important topic. And I think it's important not only from the medical point of view, but also from the cultural point of view. Erectile dysfunction is always taken in popular culture as something to be made fun of. And I find that quite disappointing, because I think that leads to more stigmatization and it leads to people not wanting to talk about it. So I think as FOXI, as advocates for the health of couples, and we need to talk about this issue more and normalize the conversation. I'm also happy to have Dr. Fessy Lewis and Dr. Bipin Pandit as the guests of honor, very dear old friends and excellent workers. Congratulations also to the moderators, Atmik and my good friend Apurva. And I am looking forward to hearing the eminent Dr. Narayan Reddy speak on such an important topic. Thank you again, Neeraj, Atmik, and Apurva, for inviting me. It's always a pleasure and privilege. Thank you.
Thank you. Thank you so much, sir. Thank you, sir. So after the blessings, a guest of honor, there is some technical problem of joining. As soon as they will join, we will get blessings from them. So I would invite Dr. Atmik to introduce the faculty for today, Dr. Narayan Reddy, sir.
Thank you so much, Apurva, sir. Dr. Narayan Reddy, sir, needs no introduction. It gives me a great honor to introduce Dr. Narayan Reddy, sir, the stalwart of sexual medicine, and he has been practicing sexual medicine exclusively for the past 41 years. Okay, so we can actually estimate the greatness. He is not only my teacher, but he has taught my father and now my wife also. Dr. Narayan Reddy, sir, is one of the few legends, living legends, who have built a platform of sexual medicine in the most scientific way, and is now delivering his knowledge, and has made sexual medicine very accessible to a number of doctors like us. If we talk about the affiliations and the feathers in the cap of Dr. Narayan Reddy, sir, so he is he has been certified supervisor of sex therapy by American Association of Sexual Educators, Counselors, and Therapists, course coordinator and faculty of the College of General Practitioners, Indian Medical Association. He has been the president of Asia Oceania Federation of Sexology, chairman emeritus of Council of Sex Education and Parenthood International, patron Indian Andropause Society, associate editor general of Sexual and Relationship Therapy. He has been awarded by many most prestigious awards like Distinguished Fellow Award by American University, Lifetime Achievement Award by World Association of Sexual Health, Lifetime Achievement Award the Tamil Nadu Dr. MGR Medical University, and Lifetime Achievement Award, Council of Sex Education and Parenthood International. Over to you, sir.
Thank you so much. Sir, Reddy, sir, you have to unmute yourself. Sir, Reddy, sir?
So can
you have to unmute yourself. Yeah, you can do. Rohit, you can do. Please. Yes, sir.
Thank you, Atmik, for your kind words of introduction.
Thank you so much.
And I thank FOXI and the Sexual Medicine Committee of FOXI for giving me a chance to be with you all this evening. And I was impressed when I saw the Dr. Shanta Kumari, Kareena Kapoor, and P.V. Sindhu talking about violence against women. I'm very happy you've chosen the topic. Now, I would also recommend, since we are talking about violence, please think about violence about unborn female child. Please see in Amazon Prime, Jayesh Bhai Jordar. That will very clearly tell you
Yeah.
how the situation in many rural Indias. In Tamil Nadu, we are seeing in southern districts feticide and infanticide, very rampant. So we all have to unitedly fight against this unhealthy custom and habit. So I'm quite happy, and I'm quite happy that Foxy is taking on all these issues, and from the medical side, sexual medicine is being taken up by Foxy. I am very glad that Foxy is supporting the cause of sexual health promotion in India and sexual medicine education in India. That's very important for all of us. Unfortunately, the MCI and now the National Medical Commission is yet to recognize sexual medicine as a specialty. Unless a day comes where NMC decides to recognize it as a separate specialty, quacks will rule the roost. Whatever we do, we can't help it. Since we are not available, people go there. Another problem again, when you take a youngster, say a person who just finished MBBS, they are all looking for a specialty where they can add a diploma or degree with them. But sexual medicine, whatever course you offer, they are not willing to take because you can't offer a university degree or diploma at the state. Anyway, I'm happy that all of us here, let us work together and promote the cause of sexual health throughout India. Thank you very much.
Thank you. Thank you so much, Narayan sir, for accepting our invitation to be the faculty for today. So without wasting time, we are now going to start our scientific session. So the viewers, is just for information to you. Since in the last year we have started this this series, the masterclass series. So we have chosen this topic, erectile dysfunction, and we have detailed about this. So about the everything. So nowadays we have a live case with us, and this will help you that how to identify, how to treat them, and from the faculty, the great teacher of us, Dr. Narayan Reddy sir. So I am going to share my slides and started my first cases. Just a minute. Atmik, is it visible?
Yes, sir, visible.
Okay. Moving to our first questions, just for information, these all are the live or the practical questions. These are the practical patients and actual patients which are encountered in our OPD. So the first question to you, sir, the case is like Mr. Ramesh is 29-year-old male, recently married, had a history of chronic use of over-the-counter sildenafil citrate 50 mg since his first encounter of sexual intercourse and got good result till 3 years ago. He had a good erection along with the use, always with the use of the sildenafil 50 mg, and his IELT was also satisfactory. He and his last partner got separated 3 years ago, and now after his marriage, he is not getting an erection over even with the sildenafil 100 mg on demand. So, sir, I just wanted to ask you the first question: what may be the probable diagnosis, and then what is the management, the counseling, and the treatment part, and what advice you want to give to these type of patients? Over to you, Narayan sir.
It's a very interesting case. Before we proceed further, I am curious as to know why did this man, Rajesh, started using sildenafil? Because it's mentioned it is since his first intercourse. Is it because he has an erectile dysfunction, or he just wants to enhance his own performance? See, many times what happens, even otherwise healthy young man with the mistaken notion that their sexual performance can be enhanced with the help of Viagra or any other brand of sildenafil citrate. Now, whatever it is, we must first think about that. Only then we can start in things in terms of management or whatever counseling we can give. Now, there are two things we have to understand here. He has been taking for a number of years. So what happens? This all go through the liver enzyme mechanism, excretion. So the probability of habituation occurring where even 100, 200 milligrams may not be sufficient. That had to be thought about. The second thing we have to think in terms is he has been separated from his partner for 3 years. And again, he has been getting into a new relationship. There is an entity called widower syndrome. If a man is having a regular partner and loses his partner for whatever reason, separation or death, whatever it is, and he had no chance to have sex for a number of years, then he fails to get erection when he attempts sex next time. This is known as widower syndrome. In this condition, the client needs to be educated, counseled, and given supportive psychotherapy. Now, the point again is very simple. The question is, if a particular molecule of PDE5 inhibitor, like sildenafil citrate, has become not effective for whatever reason, we can do two things. One, shift to another type of PDE5 inhibitor, like tadalafil, udenafil, vardenafil, and today you have avanafil also in the market. One of that can be tried. And most important, we have to check whether he has got any guilt. Why did he start using sildenafil from the first sexual intercourse? Maybe, like all youngsters who masturbate and they are taken by the quack's advertisement that it is harmful and it is a sin, they may lose their self-esteem and they may also feel guilty about that. And because of that, they may develop performance anxiety. In such a case, they are under pressure to somehow successfully perform, successfully within course on the first night itself. All this will push youngsters to start using any PDE5 inhibitor on day one of their intercourse or marriage. That's very important. So what is important here for us is to first take the proper history where we can understand what instigated him to start taking the drug from day one and what are his concerns, and we can go it for preset model and then give him supportive psychotherapy and help him to overcome that. If necessary, use a short course use of tadalafil, whatever it is. Now, coming to advice to partner. Now, if partner is supportive, that's good for us and good for the client. If the partner is not supportive and trying to find fault with the gentleman, then we have to undertake couple therapy and we have to teach them sensate focus for him to gain his confidence, as well as for the wife to understand that this gentleman can definitely get erection on his own, so that she believes in him and then the marriage can be saved and sustained. This is what I can think at the moment. If you have any further questions, I am open to discussion.
Sir, there is a 2 to 3 questions. First of all, whenever we see these type of patients, because in our practice, I'm also the sexual medicine practice, doing sexual medicine practice. So their first thing, what they are, don't give us these type of medicines. Can you give us those medicines which I can take 5 days, 10 days, 15 days, and I cure? This is the first thing. Secondly, sir, whenever we prescribe this PDE5 inhibitor, they are, maximum patient, they Googled it and then after come. And when they are seeing those, the side effects of this, then are very scared whether we should start this, not. So what you will advise in this type of patient first, and what is the safety profile of this PDE5 inhibitors?
Dr. Apurva, can you be a little louder? I'm not able to hear you. Something wrong with my computer.
Okay. Hello? Am I audible, sir?
Yeah, now I'm better.
Okay. Sir, first of all, first question to you, sir. Whenever these type of patients are coming with us, they want some medicine which are not very pharmacotherapy, and they want like they can take it for 5 days, 10 days, 15 days, and they will cure it. They doesn't want to take a long time therapy. The first thing. Secondly, when they are, we prescribe them the PD5 inhibitor, and they are getting all the side effects. They Googled it, they got the side effects, and they are very scared of using this. Sir, so I just wanted to know what is the safety profile, and in case of, suppose that a case hypertensive or diabetes, they are coming, then which PD5 inhibitor is ideal for them?
I'm quite happy you brought in about other persons like diabetes and other issues. And we have to definitely eliminate. See, many a time we make only an inferential diagnosis. Diabetes is the cause, not in this case in general. Now the point is simple. Is it only diabetes which is the cause for any problem, sexual problem, or other problems? Now, how many of us are using endopad to check the endothelial dysfunction? How many labs in India got endopad? It's a very expensive gadget. It cost more than 6 to 7 lakhs. I'm talking about 5 years ago. Now, we all go by the question of inferential diagnosis. Assuming if diabetes may be the cause, we can try to maintain the endothelial health with the help of nutraceuticals. See, even though we are qualified MBBS and allopathic system of doctors, let us not debunk nutraceuticals. They have their role to play by maintaining the endothelial health. And of course, smoking and drinking, all that we have to advise the client not to use it. Now, basically, the question is how much the wife is putting pressure on him. If it is so, that has to be assessed. And that is why whatever counseling we do, we have to do in the presence of the wife also, so she can understand what are the dynamics and what is happening. Now, very rarely, the women will not come to our clinic. See, most of the time we make one mistake. There are 3 main reasons. One, the clinician has not advised them properly. Why you have to bring your wife? Doctor, sir, erection is my problem. Why should I bring my wife? That is the thinking they have. So we have to explain to them the need for that. We have to explain to them that sexual response is psychosomatic and between 2 individuals. So our own cooperation is also required. One. Number 2, the second reason may be the client assumes, Dr. Saab, in India, you think wives will come here, women will come to the doctor's clinic, especially for a male doctor. Their assumption. But take my word for granted, in this past 4 decades of experience, women are willing to come and pour out their problems to the doctor provided they are confident that you are really looking at their welfare and you are professional. In fact, the success rate of all my patients which gone up wherever the wives attended is far greater than when I get an individual client. That's very important. The third reason we can have is vested interest on the part of the partner. She is not bothered. I got my 2 children or 1 child, whatever it is. I fulfilled my role of being a mother. That is fine. Or she may think, initial days of my marriage, I asked this man to take help. He didn't take help at that time. Now, why should I help him to become all right? Sometimes, making this man dysfunctional, she can get some additional benefits. I have seen in my practice, the man, because he has lost his self-esteem, he will dance the wife's tune, buying her additional clothes, additional saris, jewelry, etc., and taking care of her parents, that is his in-laws. If he becomes all right, he may not do that. So that also may take place. The last one is, in India, we all believe in karma philosophy. One may think that it is my karma. All it's supposed to be a man's job, not a woman's job, to think about sex. Since this man is not able to, let me forego that, let me lead my life otherwise. So once we do that, and we're able to bring the lady partner to our consultation chamber, then our job and task is much easier.
Very, very truly said, sir. So what's the role of counseling is definitely, sir, very important in this type
Dr.
of patient.
Apurva,
Correct.
I can't hear you. I'm sorry.
Okay, sorry, sir. The role of counseling is definitely, that means, is very important for that.
Yeah.
Okay. Okay, sir. And about the safety profile, sir, if you are using the PD5 like sildenafil or tadalafil in case of hypertension and diabetes patients, sir, what is the safety profile? Should we
If the
use? Should we
client
not
is
use?
already got hypertension,
Sir, I think
unless he is on a multiple antihypertensives. So we can monitor that, and that is not going to be a major handicap.
Sir, what is the best PD5 inhibitor in case of this cardiac disease? What is the best one?
I always start with the sildenafil citrate. Nowadays, I am trying to use avanafil because within 20 minutes, they say the erection will come. But my experience is avanafil is not that effective. In fact, sildenafil is much better. And if you are looking for a longer duration, tadalafil is also good. The only problem with tadalafil is you have to first inquire about lumbago or other joint pains for the client.
Yes, sir.
Sir, one question. Is it like that for on-demand sildenafil is better?
Severe pain. So that's we have to really feel. And if you're not satisfied, you can switch over to tadalafil. Vardenafil, I used, it was quite effective. Again, unfortunately, I don't know what happened. In Chennai, it is not available nowadays. Ajanta Pharma came with it, it's not available.
Yes,
But
sir.
the best one is the Korean product called Udenafil. It got less side effects than sildenafil and tadalafil, and it is quite effective. Again, that should work in about 25 to 30 minutes. The half-life is 4 to 5 hours, so quite convenient for all of us to use. But again, Zydus has withdrawn from the market the drug because the patent issue is not available in the Indian market now.
Thank you. Thank you so much.
Ready, sir, one question.
Neeraj sir, I think there is a technical issue. Sir has is not seen. Yeah. Atmik, we can take up the second question. And by the time sir will join, we will take the question from second. Now, over to you, Atmik.
Okay, sir. Thank you. Okay, so moving on to the second question. The patient is Rajesh. He's a 29 years old male and married to a 28-year-old girl, Jyoti, for past 1 year now. Rajesh had a good erection in the beginning of his marriage, but unfortunately, Jyoti suffered from a condition called as vaginismus since the very beginning. This condition led to non-consummation of marriage for the past 1 year. Now they have arrived for treatment, and their main complaints are Rajesh is not getting a good erection, as Jyoti has complained, and Jyoti, there is one more complaint, like Jyoti feels that the size of the penis of Rajesh, an erect penis, has reduced.
A very, very interesting case.
Apurva sir? Ready sir? Just a moment, please. Apurva sir? Am I audible?
Yes, Atmik, you are audible.
Sir, I think we need to move the slide for the questions, and Apurva sir is.
Yeah, he is.
Yes, sir.
Apurva, next one.
Sir, next slide, please. Apurva sir, next slide. Yeah, thank you. Sir, ready, sir, what could be the probable diagnosis in this case? How can we manage this couple by counseling and treatment both? What advice would you like to give to the partner? And what is the role of office sildenafil test? If you can throw some light. Over to you, ready, sir. Thank you.
Thank you, Atmik. It's a very interesting case. It reminds me of one of my first cases in 1982. I'll first tell about my case and then we go into this.
Yes, sir.
In 82, I brought the first sexology national conference to Chennai, Stanley Medical College. The second national conference, first national conference took place in Bombay in 1981. Prakash Kothari and Dr. Vasa. So 82, I brought it to Chennai to promote it in South India. Lady journalist, there was a woman's magazine in those days called Eve's Weekly. Now it is closed, like Femina, Eve's Weekly. So they featured a article about the conference and about myself. Subsequently, I had a couple, young couple. Now, the lady was quite modern by those days standards, 82, bob hair, wearing tops and jeans, and she represented Chennai, Tamil Nadu, in one of the sports activities. Why I'm giving this background? She is not orthodox or anything. She is very modern. It's not conservative. Now, the story goes like this. They being North Indians, but settled in Chennai. The wedding took place in the night in a 5-star hotel. And the girl's parents very thoughtfully planned for the couple's honeymoon by a train called Blue Mountain Express in Chennai, which goes to Nilgiris or Ooty in the night. And they booked very thoughtfully a first-class coupe. Only there are 2 berths. Nobody can come in that. Right on the Southern Railways, nothing happened. So they thought, okay, we'll go to Ooty. We tried there. There, when they went to Ooty, stayed in the hotel, they tried again, they failed. They couldn't consummate the marriage. It went on for 2-3 days. They cut. Fortunately or unfortunately, The boy's sister, elder sister, was a doctor, and she was a spinster, unfortunately. So she took her to one of her professors. Now, please pardon me if I sound critical, but with due respect to all gynecologists, I strongly believe none of us can pick up something if we are not taught something. For example, you can't expect me to treat a person with a cardiac problem. You can't expect me to treat a person with a gynec problem. I am not trained. You can't train me. So sexual medicine was not taught in those days. So that first professor of gynecology diagnosed it to have a tough hymen, and she did a hymenectomy. Still nothing worked out. So what they went for second opinion. And those days, there are 3 medical colleges in Chennai. They went to the professor in a second medical college. Now, this doctor told the first one has not done surgery properly. There are remnants of the hymenal ring. We have to remove that one also. So the couple subjected themselves to that. Still nothing happened. The girl, being outgoing, she questioned the doctor, "Madam, you told me that the first person has not done properly. You have done something. Still nothing is working out. Why is so?" The professor got angry and shouted at the girl, "I have done my job properly. Your husband cannot do. Something is wrong with that fellow's erection." From that day, the man earlier was getting an erection, stopped getting an erection. Right? Then I went on digging in the history. In fact, I gave her 2 options. You require a vaginal examination. If you don't mind, I will examine you. Otherwise, I'll give a letter, go to a concerned gynecologist, get an opinion from them. The lady questioned me back, "Doctor, you don't have confidence in yourself. You're a doctor. Why don't you examine me?" Then I asked why. Then only the entire story came. Now, when I dug into the history, what happened was the girl's grandmother, she was against this marriage because it was a inter-community marriage, the North Indians. She said, "All you youngsters are English educated, government educated. You don't listen to the elders. At least now you listen to my advice. First night will be painful. However painful it is, kindly bear with it. Don't make an issue. Then things will smoothen out for you." A girl who never thought about pain on first night, the grandmother put the seed. It will be painful on the first night. So she started anticipating. She was clenching her vaginal muscles. Something like here. Here is a very good case. And whenever you have a unconsummated marriage, or when a girl comes to you asking for help her to get a pregnancy or conceive, please rule out vaginismus. Very important for all of us to know that. Now, in this case, I would like to first know, when they came to us, whether her vaginismus has been resolved or not. If it has been resolved, then we go in a different direction. If it has not been resolved, then we need to address that issue first, help her to learn to relax, and then take up the other issues of not getting an erection. Now, what happens if the man keeps trying to enter his wife and is not able to enter her, his self-esteem is dented because he is not able to understand there's a condition called vaginismus. They all may think something is wrong with me, the man. Why is that I'm not able to get inside her? So he may think that the erection quality is not good. It's got erectile dysfunction, whatever it is. Unfortunately, nowadays, people go on internet, they surf, and they straight away come and say, "Doctor, I have got ED." They won't even describe the problem. They say ED. So he may think that. So his self-esteem may be dented. Attempted failures, fear of failure again. that comes. And finally, the most dangerous and deadly weapon is the partner's criticism, mainly saying your penis size is small. Now, how many men can take it?
None, sir.
It is very, very difficult for a man when the woman says your penis size is very small. That means she is saying you're not man enough. So, all this compounding together, now he may develop erectile dysfunction at this stage now. Now, what we require to do is, as I mentioned earlier, handle vaginismus if it has not been resolved already. If it has been resolved, good. Then what we require to do is education for the couple, counseling for the couple. And where education is required is to tell that the penis size doesn't make much of a difference unless there's a micro penis. Even a 2-inch long penis of erection is sufficient to achieve penetration. That has to be told. And that's very important for us. So limited information, education is important, and the importance of partner active participation and not putting down the male partner has to be explained to the partner, and that will go a long way. Or you can also simultaneously undertake for both of them, one, addressing the vaginismus issue, addressing the erectile dysfunction of the husband. In my practice, what I do is, when I undertake this type of cases, I always do one thing. My sessions are basically, first off involves only education. I don't show pictures. Why I am worried about people can accuse me of showing pornography. See, one complaint goes against us that the doctor is showing pornography picture on his computer or on the diagrams, and the media picks up with the headline news. The entire reputation is lost. So I always use line drawings, explain to the couple the anatomy and the physiology of the male and female genitals. A little bit, not everything. One day, one session I will teach them only about male, the second session only about the female. Then I talk about the response like that. Along with that, I add sensate focus. So when they start doing sensate focus and enjoying the touch sensation, slowly you realize, the couple realizes the man is capable of getting an erection. And number two, the wife will also enjoy the sensation of being touched and really becoming sensuous. Now, importance is stressed, and then take simultaneously sensate focus, education, everything. And of any given time, you can use a short-term use of a PDE5 inhibitor for the man to boost his self-esteem, because with the help of this, temporarily he can get an erection. His confidence levels will go up. So that is how I plan. Now, if you permit me, I'll take 1 more minute of your time extra. Do we have extra time?
Yes, sir.
Yes, sir. We have, sir. Yeah.
See, remember, today, because of time constraint, I am not going into details of sensate focus. I can explain to you. Okay, Dr. Neeraj just asked me to explain it, so I'll explain it to you. Now, what happens normally when people don't get erection or got a sexual problem, their focus is only on the non-performance. So whenever they try to have an intercourse next time, like something like you have a big stone on their head, the pressure is weighing on them, Will I be able to perform well today? Is it okay? Will it work out for me today? So once that happens, the performance anxiety increases and we become our own spectators. Mind you, Masters and Johnson given a wonderful term called spectatoring. This happens even when you give a children of a citrate or tadalafil also to client without even explaining. Why? Because the client goes home, swallows a 100 milligram or 50 milligram tablet of PDE5 inhibitor, and then he starts looking at his penis. He is only looking and thinking whether doctor has given me medicine, I paid so much consultation fee, now let me see the tablet is working for me or not. Ideally, he should be looking at his wife's nude body. He should be enjoying the touching her, kissing her, hugging her. He won't do. You're looking at his only penis.
He's not fantasizing actually.
So he loses this idea. So what Masters and Johnson did was, it is something like, if they can even explain example in the movies, like take Diwar, Amitabh Bachchan acting against a mirror. What I'm going to do is good or not? Shall I become bad person or not? A debate with his own conscience, Antaratma. So we become our own spectators, looking at our own penis, our own performance. That's why Master and Johnson called it spectatoring. We should never become objective in sex. We should become subjective. We should let ourselves go during a sexual act. So what Masters and Johnson has done is to divert the attention from the performance to enjoying the sensuality. He has given the sensate focus. The word is self-explanatory. Focus is on sensations. Helen Kaplan calls it pleasuring exercises. For any sexual problem, psychogenic, be it erectile dysfunction, premature ejaculation, delayed ejaculation, woman's desire, orgasmic dysfunction, vaginal, everything, the first step always is sensate focus. This is very important. Now, in sensate focus, we tell the couple, now please undress each other. Don't undress by yourself, undress each other. See, that becomes part of the foreplay. It's like a vamp undressing in a cinema, an item song, in a cabaret show, the striptease, like that. And that gives them a more excitement, more arousal. They are diverted from the other thing to this itself. Then one of you touch other partner, starting from the head to the toes. Okay? We clearly tell them, don't look for an erection. That is not our objective. Our objective is for you to touch and feel how it feels to her when you are touching and how it feels to you when you touch your partner, vice versa. The focus should be on what type of sensation you are enjoying. We tell them, tell your partner how you like to be touched, where you like to be touched. It's very important for understand. Now, my initial days of practice, young educated couples used to question me, Dr. Reddy, what is this? We should touch each other. Right? Now, we are educated, we have been touching each other. What is new? You have told us you are charging me so much money. I had to give an explanation. What is this explanation? Right. Mr. and Mrs. So-and-so, if I can give you a cup of coffee or tea, you can drink it two ways. One, you can gulp it down and run to catch your train or bus or whatever it is, right? It is also drinking coffee or tea. Or like in the TV ad, Wa Taj in Tamil Nadu, Narsu's coffee, besh besh. Sip by sip, you enjoy it. Only when you take sip by sip, you enjoy the flavor. Both the methods are drinking. First one, you don't enjoy the flavor. Second one, you enjoy the flavor. So all along, you touch only to produce an erection. Why I'm telling you, don't look for an erection. Intercourse is prohibited. So erection is secondary at all. You are touching for sake of touching itself. This is enjoying the flavor. So once they understand that, they are able to accept that and proceed further. So the sensate focus will go a long way when you undertake for the couple, either separately or simultaneously also. That's very, very important. And number two, allow the couple to express themselves to the partner during the sensate focus. That's very important. Not to express about the quarrels, the angers, nothing. No. They express themselves about the experiences they feel when they're touching each other. Again, sensate focus is 2 steps. First one is called sensate focus non-demand. That means you tell the couple, don't touch the genitals. Everything else you touch. Since you don't touch the genitals, there's no pressure. It's called non-demand. Once they successfully do that, you go to the second step where you call it sensate focus demand, where they start touching other portions of the body. They also now start touching the penis, vagina, and the breast. Since they are going toward the genital organ, it is called sensate focus demand. Again, every time you have to emphasize, don't look for an erection. Do not attempt intercourse till I tell you. Enjoy only the touch sensation. That's very, very important for us to tell. In fact, if you remember, those of you read Vasana Kama Sutra, a thick emphasis was laid on sensuality. 2-3 chapters are devoted only on the sensuality. That's very important. That's how you get women to get aroused and get involved. Unfortunately, we don't do that because nobody teaches us. We must understand. See, today I am 72 plus. I got married when I was 24 after I finished my MBBS. My parents thought if I go abroad, I'll marry a foreign girl. So they pressured me to get married at that days. And you know what I got for wedding gift? 3-4 books of Khajuraho sculptures. I did not know what to do with that. See, later on, after 50-60 years of practice, I realized that what it really comes to us says are important for us to incorporate. Anyway, the point is, however educated they are, they may be a nuclear scientist, double PhD, or a software engineer, MBA graduates, etc. No problem. They are, as far as sex is concerned, their knowledge is that of a platform person. They require to be told that sex is not bang, bang, thank you, ma'am. You have to touch either, enjoy the sensuality, and then go for that. So when you do all these things, I'm sure there is a solution will be arriving at. Now, coming back to use of sildenafil office use. In my experience, I stand corrected if somebody has got different experience. Office use of sildenafil doesn't work out because sildenafil, it has to work. A person should be involved. If he's going to look for an erection and if he's got to stimulate himself in the alien atmosphere, he may not get an erection. See, this is advantage when you give an intracavernous injection because it overcomes all that alien atmosphere and observing himself because the drug directly acts in cavernous spaces. Whereas the oral pharmacotherapy is not beneficial to that extent. Rather, I would tell them, counsel them, give him supportive therapy, prescribe for him sildenafil, ask him to go home and try it. So that will be better off, in my opinion.
Sir, very correctly explained, sir. Yeah, sir, Neeraj sir. Yes, sir.
Yeah, Dr. Fesi sir is there here, so you can just invite him.
Okay. Hello. Dr. Facey, sir.
No,
First of all, sir.
Let's sir finish the talk. I am hearing from the. I could not join through the. Zoom, but I was hearing in the live stream. So let us not discontinue or have a break in his talk. Sir.
No, sir. We finished up the second question.
Yes,
now we will take up the third question, sir, after your blessings. Thank you so much, sir. And first of all, sorry from our side, there is some technical issue, and that's why you are unable to join. And sir, definitely about Facey, sir, doesn't need any introduction. Sir is the Vice President Foxy, is always there for us, always blessings us. Sir is an infertility specialist. Sir, over to you, sir, for your kind words, sir. Yes, sir. Facey, sir.
Good evening. Good evening to all. Respected Narayan Reddy sir and Neeraj, who's the committee chairperson, and coordinator Dr. Apurva. I think the being not only being vice president, being an infertility specialist, I have been hearing Reddy sir for quite long time, and definitely as sir was telling, in the Foxy's interest in this sexual medicine has paved the way for the giving solution to a lot of patients, and not only to the infertility specialists, to the most of the gynecologists. They are the first line contact when they have sexual problem, and most of the time they are not getting proper guidance. Now with this awareness, I think a lot of patients are getting benefited, and as sir was telling, in the role of quacks in the field is coming less, and so their proper advice and treatment and is getting to those needy patients, and which will be really beneficial. I think thanks for Neeraj for taking this initiative, and Reddy sir for coming us and giving us good advice. Without wasting time, I think we are eagerly waiting to hear from you for the next session also. Thank you, sir.
Thank you so much, sir. Facey, sir. That you joined and you are there for blessing us. Thank you so much, sir. So we moving to our next question. And sir, before sir, am I audible? Narayan sir. Yeah. Before we start to the next question, sir, usually many time patients are coming and asking us ki without pharmacotherapy, like non-pharmacotherapy, is there any exercise? Is there like Kegel exercise or some other exercises, or some food like the nutritious diet or some particular food which they are like? Many times the patient are asking me that whether garlic is very important to counter this problem of erectile dysfunction. So is there any food like non-pharmacological treatment and nutraceuticals, or any food items are there, or any exercises are there to improve this problem? Narayan sir.
Yeah. The word used by most of the clients are, is it natural? I want it to be natural.
Yes. Very true.
Because
very true.
Yeah, they don't want to use a drug, so they want to say natural.
Natural.
Yeah. I counter question them saying that if you want to have a natural thing, why did you come to a doctor? Simple. The very fact you reached out for help, you leave the job whether to go pharmacotherapy or non-pharmacotherapy to the doctor. Let the doctor make a decision, give the options to you, then you can choose. Now, you can explain to them, first let me find out what is the root cause for your problem. If it is due to physical factor, then obviously you require medication or whatever it is. If it's not due to physical factor, then yes, definitely without drugs, I'll undertake sex therapy or counseling for you. We can help you out. Now, this is where nutraceuticals come into picture.
Yes.
Please remember, there is something called placebo effect. All of you are aware. All of us are aware. Now, nutraceuticals will work definitely better, because for my PhD in 1980, 88 to 93, I studied Ayurveda English version at Pune's Bhandarkar Institute. Because I was doing a PhD thesis on sexual disorders in human males pertaining to use of available herbs in the market. That's why I was forced to read that. Charaka Samhita, Ashtanga, etc. Now, most of the herbs are antioxidants. One or two of them, they are dopamine agonists. So that way they're useful. But the point is, they cannot be used on demand. It has to be a long process. And as you know better than me, Ayurveda works by saying we will correct the entire system so the natural flow takes over. So it's going to be long-term process. So what I can do is to give some reassurance. This is a natural thing. The people have got some wrong notion that herbs don't have side effects. They always ask when I prescribe Selna for anything, doctor, are there any side effects? The fellow can go and eat dirty pani puri from the roadside. He will eat oily food. He will go and one-way traffic other way. Doesn't follow traffic rules. There he doesn't bother about side effects. When it comes to doctor, he worried about side effects because unfortunately Amir Khan has said that in his TV serial and media highlights it. So they have to think about all those things. So I capitalize on that belief that herbs do not have side effects. Prescribe any nutraceuticals and tell them this is not caught on them. It is natural. We are prescribing only natural ingredients. And after assessment, if you think it is psychogenic, you can offer them non-pharmacological treatment like education, counseling, intensive therapy, etc., etc., etc. So there's no issue.
Okay, thank you. Thank you so much, sir. And what many people are advised to have the Kegel exercise or like interrupted urine, like when they are urinate, you have to stop, then again start. Is this type of exercise does help? And many a time, even I have shown some ad, and they have said that in the gym, if you are doing this exercise, there will be more better that you will be better in bed. So is there anything like that, sir?
That's the problem. People go to doctor, WhatsApp, doctor, Google, etc. They listen to third persons, friends, except anybody, except listening to doctor. That's why the entire problem comes. So we have to be a little assertive when you talk to the mind. Does not mean you have to be rude to them. You don't have to raise your voice, but be firm and clearly to them and tell them initially in the pre-Viagra days, I didn't have any drug, no sildenafil citrate, and no SSRIs for premature ejaculation. The only tool I had was sex counseling and therapy prior to 1998. When I tell them your problem may be due to psychological causes, they refuse to believe me. And I used to get depressed because I was losing clientele. So at that time, from Johns Hopkins, Baltimore, he comes to me, he said, wait for your time, they'll come back to you, one. Number two, always prescribe a placebo. That's very important. Even for doctors, prescribe a placebo, he said. Now, after 3 years or 4 years, I realized the same person coming back to me. Why? They went window shopping. Each one tried something else to prescribe. Nothing worked out. Then they come back because you, beginning itself, you told drugs will not work. Your method is going to work. So they have trust in you. So stick to whatever you think is done. And very important for us to understand, we are not trying to treat a case. We are trying to handle a human being who has got a mind. That's very important. You would have noticed in our medical college, the gold medalists will not have good private practice. A chronic condition will have a wonderful private practice. Why? That fellow does not know how to handle clients. So what we have to understand is you have to handle a customer. I'm sorry to use this word, but with the customer, what is important? Customer satisfaction. That's very important. So you may be forced to prescribe placebos. Nothing wrong with that. Is not unethical also. All that we require is helping the client without cheating him. That's more important.
Yes, sir.
Thank you so much, sir. And sir, before we proceed to our next question, there is a question in the chat box by none other than Butfesi, sir. That is sildenafil or tadalafil, which are commonly available in market, is better with less side effect for 2 to 3 week use.
Better to?
It is available is better with less side effects for regularly 2 to 3 weeks use.
Yes, see, both of them got side effects. We do not know which one will affect which person. So you try. If they have any side effect, then you change over. That's the only way. Unless we use it, we never know what are the side effects. You have to remind everybody and think even yourself. Newton's third law. For every action, the equal opposite reaction. If there is no opposite reaction, there is no action. If there are no side effects, there is no effect itself. The physician's knowledge, integrity, which decides how do you weigh the pros and cons, balance it, and then what is going to prescribe. That's very important.
Thank you. Thank you so much, sir. Moving to the next question, because we have a very long questions with us. Next question is again a very important and very interesting question. Rajesh is 37-year-old male, married for past 7 years. He and his wife, Jyoti, often falls into a quarrel and do not talk for few days. Rajesh satisfied his sexual craving out somewhere with his office colleague Rekha and sometimes masturbate. But he often complained of an unsatisfactory sexual act with his wife because of a delayed erection, which is soft and difficult to maintain also. So, sir, what is the probable diagnosis? What is the management for these type of patients? And specify some non-pharmaco. I think sir has already stated about that. Sir, what is the probable diagnosis and how we'll manage this case?
Yeah. Question 1 and question 4 are same. Probable diagnosis has been how to differentiate. Yes. Here, the history itself is explanatory. See, the man is able to get erection and satisfy adjacent with somebody else, not with his wife. That means it is situational, psychogenic erectile dysfunction. And the first paragraph clearly tells a couple often get into quarrels and do not talk for a few days. So severe marital disharmony. It's very important for us to understand that. Now, remember one thing, a man cannot have sex with a tigress just because the tigress looks very beautiful. Right? Here the wife is the tigress. She is always quarreling, finding fault with him. So when he is not comfortable, relax in her presence. Definitely he cannot get an erection easily. He had to struggle, fantasize, do something to get an erection. And the erection quality will not be good. And maintenance becomes very, very difficult. So that is why it is very important for us to take history at 3 levels. One is the problem profile. Second is sexual profile. Third is interpersonal communication and relationship. If you want, I can mail you in a day or two my case sheet, which you can share with all your Foxy members.
Definitely. That will be of great help.
So, when you are taking history, the first section you take problem profile, you're talking only about the problem. Sexual profile, where you come into all these issues, whether he gets an erection in one situation, not in other situation, how comfortable a wife and husband are with each other, they are comfortable undressing each other, what are their fantasies, do they have extramarital partners, if so, why they are having extramarital partners. All that history we have to obtain. And finally, interpersonal communication and interpersonal relationship, how good or how bad they are. That will give us a clue as to where we have to focus our therapy. That's very important. So I can share that my case sheet with one of you, either Neeraj Jadhav or Admik Jain, who are no problem.
Awesome. Thank you.
Second thing, I'm sorry I'm digressing, but I have written a handbook of sexual medicine for the beginners. It doesn't drain you from statistics and all controversies. Simple in day-to-day practice, how do you handle? My co-author is Dr. Allah Reddy from Hyderabad. This book is under publication now. It will be released at New Delhi on August 5th at the National Conference of Sexology. Now, I can request the publisher to give a discount to Foxy members. There's no issue. That also will clearly give all these details. Now,
thank you.
Now here, the problem is marital discord. So first, that has to be addressed. Most of us doctors, we cannot handle marital discord. We are not marital therapists. So please take the help of a good psychotherapist who is specially trained in marital therapy. Refer the couple to marital therapy. As their story improving, then you can start your sensate focus, etc., supportive psychotherapy, persist model, and all this is said. So that's very important for us to understand. Identify the problem area, decide on the focus of your therapy, and then work accordingly. Now, one mistake most of us are doing is, I have seen many of my colleagues in other specialties, we have already counseled. It is not useful. See, for example, with due respect to diabetologist, prescribing anti-diabetic drug and telling him follow the diet chart. Don't eat rice, eat chapati or whatever it is, 1,800 calories per day. That is not counseling. That is advice. Counseling is you sit with your client, help the client to understand the need for change and ask him, allow him or her to accept that and act upon that. That is counseling. Since most of us not trained, if possible, seek the help of good psychotherapists. You can definitely give some office counseling, education, etc., etc., when you undertake PSIT model. If you understand PSIT model, the second step is called limited information and then specific suggestions. After that, any doctor can take it with a little studying and understanding. That can be done. But whenever severe marital discord is there, please seek the help of marital therapist. That's very important. And either you can wait for that discord to resolve, or if you don't want to waste your time, simultaneously undertake sensate focus to boost the self and confidence of the man, as well as improve the sensual interaction between the couple. This is how I will want to proceed.
Thank you. Thank you so much, sir, for kindly explaining this situation. So for the next question, I would invite Dr. Atmik. Please take up the next question. Dr. Atmik?
You can take a problem.
Yeah, Atmik is there. Yeah, please take up the next question.
Rajesh is a 47-year-old male, married for the past 20 years now. He's a known case of type 2 diabetes mellitus for the past 9 years now, and is now under treatment as per her wish. Means he's on and off under treatment. He withdraws the medicines if he feels like, and continues if he feels like. So he reports a good sexual life for the till 5 years back, and is suffering from erectile dysfunction after his doctor informed him about the side effects of the drug and the condition itself. So an improper erection due to the disease and its treatment. Now he finds poor erection, low libido, and lower sexual frequency. So what could be the diagnosis in this case? How can we manage such patients of chronic diabetes along with treatment? And if you can throw some light over the use of penile Doppler with intracavernosal injection and its interpretation. How can we interpret a penile Doppler report?
Thank you, Atmik. Very interesting case again. I'm glad you're bringing up very good cases for discussion.
Thank you, sir. Thank you so
Now,
much.
my probable diagnosis is iatrogenic erectile dysfunction. Now, this really happened in Chennai for me, in the sense, Chennai is well renowned for its diabetic management centers. Professor Viswanathan, doyen of the diabetology, was my professor, and he started way back in the 70s, a diabetic center. His son-in-law, and Professor Sesha, all that, they are doyens of diabetology. Now, what happened? Diabetologists initially looked at diabetic retinopathy, then came for diabetic nephropathy. Then they came with diabetic cardiomyopathy. Finally, they came to diabetes foot. Now, in the rat race in the medical field, we won a partnership. One of the diabetologists got a very good practice, and one of my juniors, what he has done is enthusiasm. Intention is good. I don't blame him. Now, in the waiting room, they put posters about retinopathy, nephropathy, etc. Along with the mentioned diabetic impotence. After that, number of people complained of erectile dysfunction, and they were referred to me. Right? So, a person who never thought about impotence of erectile dysfunction, after seeing this poster, he got worried. He developed. So that is why I'm saying iatrogenic. But however, since he is a diabetic patient, we have to rule out comorbidity-induced organogenic factors responsible for erectile dysfunction. Again, here we are going through inferential diagnosis that diabetes mellitus can cause it. But ideally, we should establish diabetes is the cause. So that is why every diabetologist, before saying that diabetes is causing this erectile dysfunction, he or she must decide whether it is diabetes is the real culprit or the other things are there. That's very important for us to understand. Now, here itself we are given is the improper action due to disease and its treatment. Now, when a person does not get an erection, what happens is he loses confidence. Once they lose confidence, they start avoiding. So the frequency becomes slow. That is why whenever a client comes to you, you must ask one question. Since how many days you have this problem? What was your frequency before you noted this dysfunction? What is the frequency after you noted this dysfunction? If you find the frequency is more after the dysfunction, that means the man is trying hard to prove himself and test himself. So the performance pressures are high, performance demands may be high. We have to work on that. If the frequency is less than before dysfunction frequency, he is avoiding fear of failure, loss of self-esteem. You have to think in those terms. So all that we have to think into the question. So frequency will be less. So once we start reduce frequency, are not able to maintain a good erection, kills our desire. You know, anyway, it is going to end up in a failure. Why try? In our medical colleges, you would have come across your friends who pay the exam fee. Some of them will not even turn up for theory. And some who don't turn up their theory will not come for clinicals. And those who come for clinicals also will disappear for Viva. They are trying to avoid because they're anticipating, expecting failure. So automatically the desire here also is lost. Now, what is important for us is to first establish whether diabetes is the cause or not. If you think it is the cause, then good adequate management of diabetes, help of diabetologist is required. Then you can resort to any of the PDE5 inhibitors along with your education, counseling and supportive psychotherapy for the man and his partner. That's very important for us to understand that. Now, I would recommend that try implicit model in this case. You don't have to go into deep psychotherapy, implicit model. And you can also try with a trial of PDE5 inhibitors, one of that, to see how. Now, coming to use of pineal Doppler with ICA and interpretation, I don't think that in this case, pineal Doppler will be very, very useful or not. One, pineal Doppler is not going to give you an additional information. That's very important for us to understand. I would withhold the pineal Doppler till everything fails and then go for doing a pineal Doppler, meant to check venous leakage or venous incompetence. Otherwise, by and large, you don't require this pineal Doppler. In fact, Rupin Shah, the renowned andrologist from Mumbai, he doesn't recommend pineal Doppler in any case. He says it is useless. I only do as a last resort. I don't think it's required in this particular condition. Any other questions? I'm willing to answer.
Atmik, yeah, any question?
No, sir. No, sir. Done on this case. We can move
Sir,
to the next case.
Yeah, we will move. Sir, before that, I just want to ask you, like, when a patient is diagnosed with a diabetes, suppose that, so when we start the therapy like PDE5 or other pharmacotherapy, after the treatment and when the diabetes is in control, or we can just have diabetes, he is getting the treatment of the diabetes and at the same time we are using the PDE5.
Yes, simultaneously both have to be undertaken. And
Okay.
let us try to maintain possible the HbA1c below 7. That's very, very important for us to understand.
Okay. Thank you so much. So moving to our next question, again Rajesh. Rajesh is 37-year-old. Just a minute. Rajesh is 30. Actually, the first line is not visible from my screen.
Sir, shall I take up?
Yeah, please take now.
Thank you, sir. Okay, so Rajesh is 37 years old male, married for the past 10 years. During COVID pandemic, he lost his beloved father and himself got infected with the virus. During the pandemic, he suffered losses in business and had to bear all the expenses of the treatment himself. After a year, he managed to cover all the losses and is now running his family business. But now he feels very dull, has work stress, sleep disturbances, and has been diagnosed with mild depressive disorders and generalized anxiety and is under treatment. Due to treatment, he has lost interest in sexual activities and experiences poor erection. So next slide, please.
Yeah. Yeah, Atmik, it's already in the next slide.
No, sir, I am unable to see.
No, October, it's not visible. Next.
Shall I go ahead?
Yes, yes.
Yes, sir.
Yes, sir.
Please.
So the next question is what is the probable diagnosis and how will manage this case?
Fine. My probable diagnosis is very simple. Erectile dysfunction secondary to endogenous depression. Okay?
Yes.
And here we must understand that the man has gone through a traumatic phase in his life. COVID, losing his father, losing his business, is slowly recovering and is already been diagnosed with a depressive disorder and generalized anxiety disorder. It is not just the treatment that is losing interest in sexual activity and having poor erection due to the factor that has got depression itself. See, this is a double-edged weapon. Depression per se can cause all these sexual problems, and many psychiatric drugs given for depression, they also can result in two things. One, affect adversely the erectile response or delay the ejaculation. In fact, in the management of premature ejaculation, that side effect have been made use of. As you know, SSRIs like paroxetine, whatever it is, sertraline, or on-demand depoxetine, they are all antidepressants. One of the side effects antidepressant delay the ejaculation. So we are effectively using that to delay the ejaculation in premature ejaculators. So the side effect is poor erection. So we have handled that. He has to undergo psychoactive medication with the psychiatrist, whatever it is. I was told among the antidepressants, bupropion is more safer than other drugs. So whatever it is, that the psychiatrist will be able to tell better. Since he has got another problem of lack of proper erection, it may aggravate the depression further. So help him to overcome that with the help of a PD5 inhibitor and supportive psychotherapy. The idea is supportive psychotherapy is that over a period of time, we can withdraw the psychoactive medication. If done by proper person and effectively, we can withdraw the psychoactive medication. So with the advantage of that, and we also can try PD5 inhibitor, very important. One more thing I would like to recommend. It is not mentioned in the textbooks, but I have personally seen in my 4 decades of practice. Most psychiatric drugs and anti-epileptics, they reduce the testosterone levels. They may not agree. You ask them, they'll still say, no, it is not going to affect. But I have personally seen practically 80 to 85% of my clients who come to me with a depression or any psychiatric problem or seizure disorder, when I send them for hormone levels, it is low. So if it is low, you have to add on testosterone replacement therapy after ruling out contraindications. That's also equally important. And again, if he's a married person, undertake counseling, educating the partner so that she can be of support to him and she can reassure him when his partner does not put him down and encourages him, understands him, and respects him, his own self-esteem and confidence will grow thousandfold. That's very important for us to understand. See, that is why it's very important for us to understand what is that we are trying to treat. I am sorry to say that with due respect to all my urology friends, many of them, including Rupesh, a good friend of mine, the day when they jumped into the bandwagon, thanks to Viagra, we became penny-centric. We are not holistic. I always tell people, please ask your client, why does he want to have sex? Why does she want to have sex? Why? There must be a reason. Prove your self-esteem, improve your self-esteem, to prove yourself to you, or because the wife is pushing pressure and demand, or living up to somebody else's standards. All that we have to find out. This single question is not being asked by any doctor to my practice throughout the country. I noticed not only here, even in the Western world. That's very important for us to understand. Only when you understand that, why does this particular couple want to have sex, then you know the focus of a therapy, what is that you want to do, achieve. For example, a man comes with erectile dysfunction, a doctor prescribes sildenafil citrate or tadalafil, he starts getting an erection. Now that is satisfy his wife? Does it improve his marital relationship? The wife will come and tell you very clearly that it becomes mechanical. He doesn't even come and touch me and hug me. Take the tablet, I believe you told stimulate yourself, he stimulates himself and jumps on me. Mind you, I have seen wherever the woman comes, they always give importance to the relationship. The main complaint is this chap doesn't spend time with me, doesn't sit with me and talk with me. He comes from office, watches TV, eats a dinner, goes on to a laptop and then sleeps. He hardly spends time with me, doctor. I'll be quite happy if you can help him to spend time with me. I don't mind, even if he's got a problem there. We can adjust. But he has to do this. So when we can't help that couple, then what are the use of prescribing Viagra? Unfortunately, the pharma companies make a mistake. They made a mistake. What their marketing strategy? For organic, psychogenic, or mixed etiology, please prescribe our brand of sildenafil citrate or tadalafil. It kills all the doctors' enthusiasm to find out the etiopathogenesis. Then what is the meaning of sexual medicine? We are trying to help a couple to lead a happy life. That you will understand when you talk about sexual health and sexual well-being. So let us not be penis-centric. Let us be couple-centric. That is why the wonderful management strategies by Martin and Johnson, Helen Kitwan, etc., they always talk about couple therapy. That we are missing world over today, and especially in India. I am sorry to say this, but as far as I am concerned, in my practice, I try to incorporate. I do agree, every male kind will not bring his wife to me. Agreed. See, I am not a superhuman. I explain to them, they're doing well and good. If they don't come, I can't help it. I only go by what I ask for it. That's it. I give my options to them, let them choose. Like a la carte. Simple. I keep my conscience clear. I have picked up the diagnosis. I explain it to them. It's up to him what he wants. So please always remember, try to find out what is that is going to achieve by getting an erection, if he is able to perform intercourse one way or other, either in premature ejaculation or with something else. So that's very important for us to understand. Please focus on the couple and the relationship. Thank you.
Thank you so much, sir. Very beautifully explained. And really, sir, your thoughts and your ideas are great. You should not have the penny-centric, and it should be the holistic approach. Very, very truly, sir. So moving to our next question.
Apurva.
Again, Raj. Yes, sir.
Yeah. Sir, I want one question. When you put any patient on testosterone, in which cases you would and what will be the dose and duration of the patient on testosterone? Your use of testosterone, can you share that with us?
Sorry, I can't hear you. You can, somebody can.
Narayan sir, sir is actually asking that when we actually prescribing the testosterone, like you have told, ki, by when we have to test and it's when we find that the level is low, we have to prescribe the testosterone. Now, when we are prescribed testosterone, and what will be the dose and all the preparation which available in the market, in Indian market?
Yeah. See, testosterone can be given orally, it can be given parenterally, and it can be given as an external application gel. I would prefer oral only for one reason, because it maintains steady levels of testosterone. Now, injectable ones are cheaper for the client, but it's a high and low ebb. So initially when they get injection, the levels go high up and then they start coming down. And external application is not suitable to country like India because we sweat a lot. It'll all go away because of that. And they tell us to apply on our back, and very difficult for us to reach. If you tell the wife to apply on our back, then she may become androgenized also. So I don't like to go into that. Orally, testosterone undecanate, the very good molecule, bypasses the liver mechanism, metabolism. It comes in 40 milligram capsules. The ideal dose is 2 capsules in the morning and 1 capsule in the night, along with the food. It requires some amount of fatty food for its better absorption. That is why when Organon introduced this in the Korean market initially, they failed. Why? Because Korean food is mostly steamed or boiled. They don't have anything. Whereas here, for one masala dosa, we have enough oil here. And on butter naan, we have enough oil. So it goes in very easily, no issue. Only thing, rule out contraindication like enlargement of the prostate and check the PSA levels. And keep monitoring every 2 months. That's very important for us to understand.
Sir, how long we can give? Like up to like 3 months, 4 months, 6 months, the testosterone?
Yeah, if you are able to maintain the levels after 2 months, then I reduce the doses to 1 in the morning, 1 in the night, the 80 milligrams. I go up to 6 months and then try to withdraw it and check whether the levels are falling again or not. If it doesn't fall, well and good. If it falls, then again restart it. That's important.
Okay.
Now that is, I know what I call black gram. I think it's urad dal, if I remember correct, the Hindi name, black gram. It molecular chemical structure is similar to testosterone molecule. So we'll prescribe, ask them to eat more of food with urad dal, etc. That'll be very, very useful. Or you can switch over to DHEA also. No problem.
Okay, sir. Sir, one more question before we moving to the next case. Sir, you are talking about the bupropion is the most important in case of psychogenic dysfunction. So, what is the dose of this bupropion and how many time 1 month, 2 months, 3 months you want to use that bupropion?
Which one?
Sir, you have talked about that psychogenic in case of the psychogenic like erectile dysfunction, you are prescribing the bupropion or the amitriptyline most commonly. So what is the dose and how many months or weeks we are continue this?
I don't have an idea about the dose. Psychiatrists only have to decide. But the point is, as long as the person has got depression or anxiety disorder, he has to take minimal dose at least of bupropion. So till that time, we have to add on PD5 inhibitor or either single or along with testosterone.
Okay, sir. Thank you, sir. So moving to the next question. Rajesh is 42-year-old male, married for 20 years. He had the history of chronic use of alcohol, cigarette smoking for 27 years. Few years back, he was admitted to the hospital for chest pain and got his first angioplasty done. Since then, he had been using oral nitrate twice a day along with other life-saving drugs. He visited the clinic for sexual health checkup as he wants to resume his sex life. On inquiring further, he told of his last sexual encounter 2 years back, no morning erection, and no sexual fantasies. So, sir, what is the probable diagnosis and how will we manage this type of cases? Sir,
It's
over to
very
you, sir.
important for us to understand one of the killers, enemies of a good erectile response or sexual response is alcohol. Second is smoking. Now, alcohol affects by damaging the liver. As you know, the testosterone produced by the testes, it metabolized into dihydrotestosterone by the liver. So once liver is damaged, this metabolization cannot take place. So the bioavailable dihydrotestosterone to the target organ is reduced. Apart from that, alcohol is a central nervous system depression, as you know, all of you know. Again, cigarette smoking, a nicotine, the tar, etc. in that, it will harden the blood vessels, including cavernosal vessels. Endothelial dysfunction will occur because of that. So, erectile dysfunction can definitely occur because ENOS, endothelial nitric acid synthase, is not available. That's very important. Now, for us to understand here, if the gentleman has got heavy smoker, it definitely would have affected his coronary arteries also. That is why today they are saying organogenic erectile dysfunction is the most independent marker for future catastrophes like stroke, cardiac arrest, etc., etc., etc. Now, that is why this man has already got an angioplasty done. It's already affected his coronary arteries. Then, he is using oral nitrates twice a day. Now, the question is, if that is so severe angina, and he has to take it twice a day, that means he has got a very major cardiac problem. A proper cardiac workup has to be undertaken before we think of anything else there. Again, he says that his last encounter was 2 years back. That means, did he not attempt sex in the past 2 years, or he tried and failed? See, whatever it is, there's a problem there. Now, the question is very simple. He may be worried that he may get a heart attack because during sex, because it's already an angioplasty in situ. And then what to do, how to handle this? As I mentioned again, testosterone levels may be low in this man due to liver dysfunction. Now people may be wondering, testosterone we heard is important for desire, but how is it responsible for erection? We have two types of nitric oxide synthase. One is the endothelial nitric oxide synthase, which occurs in all blood vessels, which is responsible for converting, as you know, this L-arginine into nitric oxide. Whereas every nerve has to be supplied with blood vessels, and if the blood vessel there is damaged due to endothelial dysfunction, what you have is neuronal nitric oxide synthesis damage. And that's how the erection problem occurs there. Now, that is affecting testosterone is affecting, you have to think in terms of that also. Now the question is, there are two ways of handling when a client is on nitrates. One, if possible, in this case I'm a little skeptical because it's taking twice a day. If possible, withdraw the nitrate for 24 hours before, 24 hours after use of a PD5 inhibitor. And in this patient, I will not go to tadalafil, any long-acting PD5 inhibitor, short-acting, sildenafil, udenafil, or avanafil only. Simple. Now, if that is not possible, we cannot withdraw nitrate. At the same time, we have to help him out with a PD5 inhibitor. There is a wonderful drug called ranelozine, ranalozine, ranelozine. Ranelozine is a vasodilator. It handles by interfering the sodium and potassium currents intracellularly, thereby reducing the accumulation of calcium intracellularly. The calcium levels are high, it will contract. Calcium levels are low, it will relax. That's how it is going to produce relaxation in the cavernosus smooth muscles as well as in the coronary arteries. It's a very wonderful drug. This can be used instead of nitrate. You can safely use sildenafil citrate along with ranelozine, no issue. The only thing is, ranelozine will increase the blood levels of sildenafil citrate or any PD5 inhibitor. So you need to do the dose adjustment. That means give less dose of PD5 inhibitor. Try and see whether that is going to be helpful before you increase the dose. See, why it is that we tell clients or we don't tell our doctors, don't give PD5 inhibitor when somebody is on nitrate. PD5 inhibitor lowers blood pressure. Nitrates lower blood pressure. When it taken together, the resulting lowering of the blood pressure is fatal. So it may be dangerous. Whereas ranelozine will not decrease the blood pressure. So you don't run the risk of reducing the blood pressure, dangerously. So that can be used instead of nitrate, but I would still suggest that let us take a cardiac opinion. Why? Because consumer protection. If somebody goes to court, our own enemies are medical community. He'll go to somebody else and say, why did doctor prescribe this one? No, you should take only nitrate. Should not take this. It's not correct. That fellow will sue us. The better take a cardiac opinion, always. That's very important for us to understand. If we can do that, that is very useful. The side effects of ranelozine are milder only: dizziness, headache, constipation, and nausea. You can titrate the dose. It is available in 500 milligrams and 1000 milligrams, taken twice a day. Adjust the dose to reduce the side effects if the client has got side effects. That's very important for us to understand that. Now, if we can do that, we should be able to help the client. One. Coming back to use of vacuum suction devices, my experiences with the vacuum suction device is not very unsatisfactory, because their clients will get tumescence, but they don't get rigidity. So if we have to use erectile dysfunction vacuum devices, use it along with a PD5 inhibitor, then their rigidity is better. If you use only vacuum suction device, tumescence also will be there, the rigidity will not be there, which is not useful for penetration. And number two, and they cannot use it for more than 20 minutes, this elastic band. Otherwise, you run the risk of producing gangrene in the penile tissues. That's very important for us to understand.
Thank you. Thank you so
Thank you,
much,
sir.
sir.
Thank you.
Sir, before we move ahead, I just wanted to ask about the testosterone, because since we are also practicing infertility, it is a common known that if we are using testosterone for a long time, it reduces the quality and quantity of sperm. So, what's your experience? Is true, sir?
Basically, I don't deal with infertility or any kind of cases. But my observation, I can tell you, I agree with you. A long-term use of testosterone will adversely affect the sperm quality. But what I realized, I was told was, once you withdraw testosterone, after some time, the body gets used to low testosterone levels and the sperm quality improves.
Oh.
So you will be better judges than me as far as fertility is concerned.
Okay, okay, sir. And sir, what in hypertensive cases, if we have a two choice like the sildenafil and tadalafil, in hypertensive cases on antihypertensive, so what will be the treatment of choice? Is it the sildenafil or is it tadalafil? Hello, sir. Hello.
Hello.
PDE5
Hello.
inhibitor.
Yeah.
God forbid, when the client long-acting PDE5 inhibitor, he develops an angina. The cardiologist is stuck because he cannot prescribe nitrates to reduce the angina. We have to wait for quite a long time because half-life is this almost 36 hours. Whereas in short-acting, it's only 4 to 5 hours. You give supportive management and then you can always give nitrate.
Nitrate. Okay, sir. That means sildenafil has a short acting and very. Okay, sir. Thank you, sir. Thank you. Dr. Atkins, take the next question, please.
Thank you, sir. Rajesh is a 29-year-old male, married for the past 3 years, unable to consummate. On further asking, he mentions of losing an erection just before he tries to penetrate. He also mentioned that he starts losing an erection when he tries to put a condom and finally loses as soon as he tries to penetrate. Sexual frequency has been reduced significantly because of all these incidences, but he gets a good erection while masturbating and watching porn alone and not with a sexual partner. Sir, what could be the probable diagnosis, management in such case, and what advice could be given to the partner?
Yes, Atmi, can I go on?
Yes, sir. Please yes, continue.
The problem comes only when he tries to put on a condom. So it is situational, thereby psychogenic. It cannot be due to organogenic factors. Now, what happens is normally during a foreplay, there is a continuous touch by the partner to the client, male partner. That body is on touch, that gives arousal stimulation. When they disengage, in order to put a condom, one, he is distracted because he has to tear open the cover and then very carefully unroll the condom on his penis. So he is distracted. He is not looking at his partner, only at his penis, and the physical stimulation is not coming there. So he will lose direction. This not only happens where they want to put on a condom, it also happens a young couple who are trying to consummate the marriage. Because again, during foreplay, everything erection is good. But the man has to come on top. He is disconnecting from his partner by touching, trying to find a right position to get in. And unfortunately, when we were born, we were not given an owner's manual by our God. When you buy a phone, you get an owner's manual. Buy a television, you get an owner's manual. When you are born, who has given? No optician given me a owner's manual. I do not know what I got. How will I know what my wife has got? She also does not know. So it's difficult to locate the vaginal opening and try to put his penis inside. And remember, when the man is coming on top, his line of vision is above her breast, on her face, not her vagina. So he struggles. In the process, he's getting distracted, he will lose direction. That is why young couples and newly married couples, the best position is, like our ancestors did, the woman will lie at the edge of the cot, spread her thighs and knees, have a niches position, or put her legs on the standing husband's shoulders. She can hold on to the penis, guide it into her vagina. The advantage is the man's line of vision is direct to where the vaginal opening is there. She is guiding it, and she is standing. His body is not trained. See, most of us stand, most of us walk, our hamstrings are strong, calf are strong, but our biceps and triceps are not strong unless you do regular push-ups. So in man on top position, we have to support ourselves with the biceps and triceps, which we fail to handle it. So this is the best position. In the olden days, our ancestors, they made the cot very high. There's a footstool, we will put the foot on that, climb out of that. It's easy for the man to stand and do that. Now commercially, what they are doing to save wood, your cots are only 2.5 feet high. Even if you put 3-inch mattress, 2 feet and 3/4 of an inch. So you have to tell him to raise the level of the cot by putting wooden pieces on the forelegs, or put another mattress on top of this mattress and raise the height to the sun. Now in this case, the best is to tell the wife, let her put the condom on to the husband. That way, it's a good foreplay technique for both of them. She is satisfied, she is doing something for the husband. She is continues to give the stimulation by putting it on his penis, by touching his penis, and he continues to get a continuous physical stimulation, so he will not lose his erection. So ultimate advice is, this comes under implicit specific suggestions.
Yes, sir.
This is very important for us to understand. So situational or psychogenic versus organic. If it occurs in one situation, not another situation, obviously it has to be psychogenic. If it's organogenic, it has to be global.
Yes, sir.
Yes, sir. Thank you. Thank you so much, sir.
Yes, sir. Thank you very much.
Moving to the next question. Actually, we are already over the time, so we have, I think, 2 to 3 questions, very different type of questions. So we'll take it very fastly so that we can get a bottom line message to our audience. So this is a case, cancer with ED. Rajesh is 65-year-old male. 6 months back, he got diagnosed with the metastatic carcinoma of prostate. The urologist suggests androgen deprivation therapy, but insisted it after a radical prostatectomy. The surgical intervention resulted in a loss of penile size by 1 centimeter, followed by surgery. He was put on external beam radiotherapy and androgen deprived therapy. Now, sir, first question is the penile rehabilitation technique before and after surgery, and the use of the sex toy. What your suggestion?
Yeah. It is clearly understood that any prostatectomy will definitely affect the erection adversely, and also will reduce the size of the penis when you do total prostatectomy. But basically, with a good penile rehabilitation technique, to certain extent, he or she can regain it. It's only 5% reduction of the penile size after prostatectomy. Here we have mentioned about a radical prostatectomy. In radical prostatectomy, the urologist mostly takes care not to damage the nerves. So the neurological damage will be much less, but still there may be something. Now, apart from prostate surgery-induced erectile dysfunction, this man has been put on androgen deprivation. Androgen deprivation definitely will kill the desire. It will adversely affect the erection because androgen levels are low, which are important to maintain and sustain the erection. And that's how it is going to be affected. And very clearly, I've seen that people with BPH, when the urologist prescribes tamsulosin plus dutasteride, which is a anti-androgen, alpha reductase inhibitor, that will again reduce the desire, affect the erection. So this is expected. So what we require is to reassure, counsel the client and the partner. It's important. The partner must also understand that. So involve the partner also and tell them over a period of time with good techniques and penile rehabilitation, he will regain his previous length more or less and will help him with getting an erection. Now, what I would recommend is add a PD5 inhibitor with the sex toy like a vibrator or something. With the wife can use it on husband's penis. Whenever the lady partner uses on the male partner, it becomes part of foreplay. So the arousal levels are much higher. And the strong vibrations from the vibrator will help the man to get a better quality erection. And with reassurance and all that, and I would recommend nutraceuticals which will maintain the endothelial health. And over a period of time, 6 months to 9 months, he'll be able to get a better quality erections. Also, we can tell the couple, it is not only the penis which is going to give pressure to the woman, the fingers, the tongue and mouth can give the same amount of pressure, if not more pressure, because the finger and the mouth or tongue can directly rub against the clitoris, friction. So the woman's clitoris is the main nerve center for woman's orgasm. So she'll be better off with that. So counsel them, initially be reluctant because how can you put our mouth on the genitals? We can tell them that mouth contains more bacteria than the genitals. If you have proper genital hygiene, it will not affect us. Over a period of time, systematic desensitization, be able to do that. That's very important for that. So PD5 inhibitor, vibrator or sex toy, then psychoeducation, counseling to the client and couple is very important. In the West, a new branch of sexology is coming up. It's called oncosexology. And there are more and more cancer survivors in the world. We read recently, in the past 2-3 days, there's a new drug they call, I forgot the name, which will totally eliminate the cancer cells in the body. Only thing, they tested only on 12 patients. The cost is very high, $15,000 for one injection, and the person requires 9 doses, not available commercially that easily. It will take a long time for it to come to India. But in breast cancer, etc., you have a pal-based, whatever it is, which will suppress that one quite easily. So all that is going to be useful. There are more and people living with the CA, prostate, or whatever it is, and we have to cater to their sexual needs. I'm happy you raised this question.
Thank you, sir. Thank you so much.
Sir, are the sex toys are freely available in India?
Sex
toys are freely available in India?
Yes, sir. You go online, TTK Pharma sells it.
Okay, sir. Thank you.
TTK Pharma manufactures condoms, etc.
Yes, sir.
They sell sex toys. I won't like to use the word sex toy. I use the word sexual aids.
Sexual aids.
To only help people. And you say toy is a negative connotation. Mind you, again, there is no law in India which is prohibiting. So customs will always create a problem in the beginning for abroad, because the customs official does not know the law. Very clear, you can argue if you're a doctor. This is for personal use, not for commercial use on the client only, your client. Nobody can touch you. But if you're bringing bulk for commercial, then you take that permission.
Yes, sir.
But India available. Go on online, you can find it out.
Okay. Thank you. Thank you so much, sir. Atmik, take the next question.
Yes, sir. Rajesh is a 29 years old male. In a road traffic accident 2 years back, his spinal vertebrae, second, third, and fourth vertebrae were shattered due to a dashboard injury. After his recovery, he used to get erections by his sexual fantasies and was able to masturbate also. Now he is married for the past 6 months but is unable to consummate. Despite of getting a good erection during foreplay, he loses the erection as his wife tries to get into a proper position for penetration. So next slide, please. Yes, sir. So what could be the probable diagnosis in spinal cord injury due to road traffic accident? How can we manage and what could be the best position for such patients? And do you think nocturnal penile tumescence test is useful here?
Yeah, it's a good quick case. Luckily for this man, he has only fractured his ES2, 3, and 4 only. He didn't undergo pelvic fracture, which is much more difficult to handle it, where urethral rupture also can take place in pelvic fractures. Now, again, as I mentioned the previous cases, he gets erection during foreplay and during masturbation. But when his wife comes to find a position, he's losing it. Situational, that means psychogenic. He's getting distracted when the wife is trying to find a convenient position. Distraction, that's important for us. Probably his back has been affected, low back. He may not be able to really support himself when he comes on top, because back muscle will be weak. So in such a case, the wife has to come on top. And people are not trained how to come on top. So in that situation, he may lose the erection. By coming on top, holding on the penis, rubbing herself against her vagina, she can start the foreplay again, make it more exciting, and do that. Now, the couple have to be counseled, explain why this is happening, reassurance, and sensate focus. Then, if necessary, add a short-term use of PD5 inhibitor to boost the self-confidence. One more thing I want to suggest at this stage here. Mind you, the coital thrusting involves your core muscles, pelvic floor muscles, low back. Unfortunately, most of us, we don't strengthen those muscles. Most of us. Doctors are not an exemption for this. So please always remember, the man cannot effectively use his pelvic floor. He gives up easily, try to ejaculate faster also. So even in premature ejaculation, that is one of the contributory factors. So I will always recommend for them pelvic floor strengthening exercises. You can send them to a physiotherapist or them to have this couple or client to do that. So that will go a long way. Now, in this particular individual case, I don't think NPT is really going to be useful because he's able to get an erection even otherwise during foreplay as a masturbation. So NPT is not required.
Sir, probably this is the last question for today's discussion, sir. Rajesh is 26-year-old male and he complained of guilt related to the masturbation, release of the semen when he wake up in the morning and performance anxiety. He also experiences generalized body weakness, joint pain, constipation, burning sensation over the eyes and abdomen cramps. Information was obtained from the literature on the internet that the masturbation causes impotency and decreased sex drive in future. He wants to stop this unwanted semen release. What is the probable diagnosis? How will manage this case?
As you
Over
know,
to you. Yes.
all of us have been taught about a particular condition known as thought syndrome.
Yes, sir.
This is a very, very typical case, highly descriptive of thought syndrome, right? So what is required is a explicit model of sex counseling and therapy for him. Intervention, and very important is there's going to be a long-term management, because once the mind goes into sets onto that, you cannot wean it away that easily. So it is very, very important for us to understand the management is going to be time consuming. Explain that to the client initially itself, put him on a placebo and start explaining things, give him permission to masturbate, tell him, educate him how not masturbation is not going to be harmful and how semen loss is not going to be affecting him, etc., etc., etc. So that's important for us. And help him to prevent masturbation further. There are 2 or 3 things we can do. Advise him a rigorous physical activity in the evenings so that he gets tired. He doesn't have the mood to think sexually and masturbate. 1. Number 2, advise him not to browse through pornographic movies or books or flip through cine magazines. When you flip a cine magazine, you find a semi-clad Kareena Kapoor or Samantha in South India or whatever it is, whoever the heroine is. So what happens is when we see that, we get aroused, stimulated. So we should avoid that and stop discussing these matters with your peer groups also, very important. To avoid that, you pick up a hobby. They can go to a computer course, learn additional educational this one. Music, if you can do that, well and good. Like a chess player, he can pick up something, etc., etc., etc. Musical instruments. And most important, I always believe in one thing. Ask him to take a warm water bath and pray before he retires to bed. Very important. Prayer goes a long way. Let them pray to Jesus or Allah or to any Hindu god. There's no problem. Now, one thing here, I face this problem. I learned how to overcome that. When a client comes to you with the fear of masturbation, guilt of that, whatever it is, you must ask him one question. How does this affect you? The usual complaint is, my penis is bent because of masturbation. 1. Number 2, my nerves are damaged due to masturbation. Number 3, it's a sin, it's unnatural. So I feel guilty. Or like in this case, I become weak, my eyes are sunken, etc., etc. 1, do not contest it straight away. Listen to him, give the impression you accepted his doubts, you have understood, you are empathetic, and you are trying to help him out. Straight away say, masturbation is not harmful, I am telling you. You will think that you have not understood him at all. Right? Now, here again, don't worry or think of ethicality. What I am suggesting is ethical in the interest of the client. If he says, his nerves are weakened, I would only do a nerve conduction study to prove them the nerves are not damaged. If he says tissues are damaged, I will take a pineal scan, prove him that pineal tissue is not damaged. Right? And you have to tell him very clearly how the semen is formed. It is an unending stream. All that you have to explain, it takes time, slowly, slowly, slowly. In the meantime, put him on placebos. My client believes that you mean business by helping him, but you're educating him. I lost many clients by initial years of practice. In over enthusiasm, I said, it is not harmful, I'm listening. Please understand that. It's very, very important. The quacks are ruling rules because we are stupid enough to say it is not harmful. Directly stateful. In a conference, medical conference, you tell this fine, not to general public state. You remember the case of this HIV? When HIV came, what did medical doctors do? It's a death warrant, there's no treatment. So what happened? Everybody wants some management. So they went to quacks. And you must have heard the famous case of a radio engineer from Kerala who made millions of rupees. And he publicly made a press statement. He is not a qualified doctor. He is only a radio engineer. And we realized a mistake later. Now we say, no, we can manage HIV. You can live a normal life. So we have to learn to handle like what they don't teach you in Harvard. This no textbook will teach you. You make a mistake, you learn. This is how you have to progress in the management of sexual dysfunction. And I crave your indulgence. I apologize if I have wasted your time or bored you with my talk. Sometimes I digress. Please forgive me. Please bear with me.
No,
Sir,
not at
it's
all.
our fortune that you are enlight us with this topic in this difficult, rather I could say this common but difficult topics, and I think A to Z, each and every aspect of erectile dysfunction says so beautifully. So, sir, I just want one question. Very latest, this question is, nowadays people are using and reported out there that using PRP and stem cell have effect in case of erectile dysfunction. Sir, what your views, and have you ever used this, especially the PRP?
I have not used it because it has not been well established. There is no conclusive data PRP is really going to help. So I am not using. I don't think at the moment this is one of the really advocated management strategies of organogenic erectile dysfunction.
Very. Okay, sir.
Very true,
Thank you
sir.
so much, sir. Neeraj, sir,
Yes. So,
any question?
no, just we can finish up what of thanks.
Yes, sir. Because we explained it so nicely and so well, sir, each and every aspect. So really, sir, it's a very enlightening talk for this talk. So after this wonderful session, it's time.
Screen sharing.
Yes, sir. Okay, yes, sir. So after this wonderful session, wonderful talk on erectile dysfunction, it's the time to say goodbye so that we can come for our next session also. So I would like to thank none other than but our own Foxy President, Dr. Shanta Kumari ma'am, Dr. Madhuri Patel ma'am, the Secretary General, our Vice President in charge, Dr. Bipin Pandit sir, our own chairperson, the person behind all this program, Dr. Neeraj Jadhav sir, the chief guest for today, Dr. Jaideep Tang sir, the guest of honor, Dr. Faisal Louis sir, Bipin Pandit sir, and most importantly, the faculty and speaker for today, Dr. Narayan Reddy sir. Need a special, really, thumbs up and standing ovation to have this topic such a beautifully and wonderfully. And last but not the least, Dr. Atmik Jan, my little brother, and who actually has done these live questions and cover each and every aspects of the erectile dysfunction which a person can think that he or she can get in his private practice. So thank you so much to all the viewers and our technical partner, the Intas Pharmacy, for giving us this platform. Thank you so much, and thank you.
Thank you, sir. Thank you so much. Thank you so much,
Thank you so much.
Reddy sir. Thank you very much.
Discussion. It was a wonderful
Yes, sir.
Really wonderful.
Sir, मेरे को कब ऐसे मैं ऐसा देखा तो it was just like 8 o'clock. It's already crossed. हाँ, it's 8 o'clock and we just finished the 4 questions. And people are thinking that ED is just a small topic and in the 10-minute lecture is what is sufficient. But it is such a common and such an important topic. Yeah,
Very true,
definitely.
sir.
Yeah. So
Only
thank you so much.
one take-home message. Sorry to interrupt you. One take-home message.
Yes, sir.
Unfortunately, world over, textbooks, they only talk about standard questions and standard evaluation. Right? This is not going to work out in sexual medicine because human behavior cannot be standardized. Sexual behavior is part of human behavior. So you cannot standardize and come to a conclusion with standard questions and answers in human sexuality. Why did they do it in the West is simple. To get US FDA approval, you must have standardized data. For that purpose, they are doing. So if you are publishing a paper, pursuing internet conference, please use those references or those questionnaires. Whereas if not, for your clinical practice, what Prakash Kothari has devised is an excellent history-taking method, simple steps. When I mail you my problem profile, you get all that thing, which you can share with all your Foxy members.
Thank you, sir.
Thank you.
Just
Sir.
please
Thank you so
remind
much.
me after a day or two. I will mail
Yes,
that.
sir,
over.
I will call. Yes, sir, I will call you.
Sure.
Thank you.
You
Thank you.
to
Thank you.
give us a matter for newsletter also.
Yeah, thank you.
Yeah. So thank you so much.